People think that Dr. Stacy Sims is telling them that an ice plunge is bad for women. I'm going to explain why that's wrong. Let's start with the thyroid. When a woman cold plunges on a regular basis, she recruits new brown fat around the base of her neck, around her heart, between her shoulder blades. And this brown fat is in constant communication with the thyroid. It will convert inactive thyroid hormone to the active thyroid hormone, working in cooperation with the thyroid to regulate metabolism. And so some women with Hashimoto's or Graves' disease have used cold plunge therapy to resolve their thyroid disorder and remove any markers of thyroid dysfunction from their blood lab results. So thyroid is one good reason why women should be cold plunging. Cold plunge will also boost sex function and fertility. There was a study that the Czech army did on their male and female soldiers using the protocol of cold water swimming followed by light exercise. And when they surveyed the soldiers, both genders reported a big boost in life satisfaction and sexual satisfaction. And it's no wonder, because testosterone is stimulated inside a woman's body during the cold plunge. About a quarter of the testosterone is synthesized in a woman's ovaries, but the rest comes from skin cells, fat cells, and adrenal glands. The cold plunge activates the skin, the fat, and the adrenals to give a woman an immediate testosterone boost. This improves her libido. It's no wonder the Czech army soldiers said that they had better sexual satisfaction. But it does more. It will also resolve insulin resistance, that is, improve insulin sensitivity, which is the origin of polycystic ovarian syndrome. A cold plunge practice can improve the function of the ovaries by removing the cysts around them that cause infertility in women with PCOS. And finally, if the woman is pregnant, cold plunge therapy during pregnancy is associated with better birth outcomes by improving insulin sensitivity so that the insulin resistance that is normal during pregnancy doesn't tip all the way over into gestational diabetes. Cold plunge is going to even help women manage menstrual cramps and menopause. There's a new study out of the University of Portsmouth in the United Kingdom where they surveyed over 1,000 British women who were doing cold water swimming. And these women reported a reduction in irritability, reduction in anxiety, better mood, fewer aches and pains, fewer headaches, and better sleep as a result of doing their cold water swimming. And what's more, 60% of those women reported that the colder temperatures increased their level of subjective benefit. Cold plunge will also help bone metabolism. That is, 2 studies out of China have observed that biomarkers of bone metabolism can be improved by a regular practice of cold plunge, reducing the risk of osteoporosis. And finally, cold plunge feels great. It's not just the norepinephrine and the dopamine, it is the metabolic boost your brain gets. Cold plunge therapy has been documented in case studies that resolve major depression, which failed to respond to medication and traditional talk therapy. If you're in a low mood, there is nothing that will snap you out of it faster than getting into the cold water. But there are some important gender differences. As a population, women are more sensitive to cold temperatures than men are. It's not due to some inherent biological difference, even though there are biological differences between men and women. The reason that women are more sensitive to cold plunge is probably because they get less cold exposure in their routine daily lives. As a population, women are less exposed to the cold than men are, and they respond faster to cold training than men do. This is consistent with other studies that Stacy Sims wrote about in her book, Roar, where she showed that women will respond to weight training or other exercise training faster than men because they're starting from a less trained level. And the same thing is true of cold. Don't come away from the interviews that Stacy Sims did on Diary of a CEO or Mel Robbins' podcast or Andrew Huberman thinking that cold plunge is bad for women. Think about the benefits that you get and think about the level of training that is specific to you. Just because a population of people have some characteristic as a group doesn't mean it applies to you. When you start a regular practice of cold plunge therapy, whether you are a man or a woman, your body will become cold trained, acclimated to the cold, so that you better defend your core body temperature. Your metabolism will improve, your mood will improve, measures of psychological resilience will improve. But if you don't want to do it, it's okay. You don't need Stacy Sims to tell you that it's bad for you. Just don't do it.